Hello, my name is Fiona Browne from the General Osteopathic Council, and I'm here to talk to you about our infection control guidance. As you know, the osteopathic practice standards provide a framework to support the delivery of ethical and, importantly, safe osteopathic care. Patients trust osteopaths with their health, and rightly so. Osteopaths should be able to explain their decisions and actions in the exercise of their professional judgment, and this will always be informed by specific discussions with patients, your own knowledge and experience, the advice of peers and colleagues, advice from government and other relevant guidance, and guidance from the regulator as well. The infection control guidance is to strengthen the osteopathic practice standards in the context of living with coronavirus. It says, 1. Be aware of updated guidance to inform your professional judgment. There is a large amount of guidance out there that you do need to be aware of to keep that patient's trust about living with the coronavirus. You need to be aware of country-specific guidance about social and physical distancing. You need to be aware about the guidance for shielding patients, country-specific clinical guidance, UK-wide infection control guidance, patients with coronavirus symptoms and other patients too. 2. Consider carrying out an updated health and safety assessment that takes into account the real risks to patients, the public, yourself, and others working and coming into contact with the practice. 3. Understand when a face-to-face appointment may or may not be appropriate. You need to be able to have a discussion about the benefits and risks with a particular patient to consider whether a video or phone consultation may be an appropriate treatment option, and think about whether a face-to-face appointment is appropriate and necessary. If you do see patients face-to-face, then you must apply infection control guidance, and that we've signposted that in our infection control guidance, and these are the sorts of headings that you'll be thinking about. Triaging patients over the phone, thinking about video or phone consultations, being aware of what to do if in contact with someone with coronavirus, having stringent infection control procedures in place, making sure you've reviewed the relevant and updated guidance, that you've assessed for infection risk, that you know about proper hand hygiene protocols. Again, these are signposted in that public health guidance, respiratory and cough hygiene, personal protective equipment, safe management of linen, the management of the care environment, including cleaning protocols and management of waste. Finally, make sure the consultation is documented in accordance with the osteopathic practice standards. So those are the key framework that you need to be able to apply to your practice. The Institute of Osteopathy has published some really helpful checklists to help you to think through those assessments and preparations, and also detailed information about personal protective equipment. It's worth having a look. Thank you.